I just ask again to please mute. Yes, we can hear you.
Great. Apologies about that.
Yes, and I would like to remind everyone that we will be recording the video, recording the webinar. And again, please turn off your video so that we can preserve the quality of the presentation. And if I could have the next slide, welcoming everyone to what we hope will be an informative webinar for everyone. The agenda is that I'll introduce myself. I'm Professor Lisa Alexander, who is the director of the RCSI PA program. And it's my genuine pleasure to welcome all of you here. And what we'll do is start with a welcome from Professor Arnold Hill, who is the head of the School of Medicine at RCSI and a professor of surgery. Arnie?
Thank you very much, Lisa. Look, it's a pleasure to be here this afternoon to welcome this really important webinar. The history of the PA program in Ireland goes back to my personal experience when I worked in the United States. The PAs have been around for so long in North America. And when I trained there, I always thought, what a fantastic profession. And it was Professor Cathal Kelly who had the insight to say, we should have these in Ireland. And he really went out on a limb to say, these are an important part of healthcare delivery for the future of Irish healthcare. And it was his passionate belief and support of developing this program, which is why we put together running a PA program. And there have been key people, and we're delighted to have Lisa Alexander with us. She's a leader from North America in PA education and delivery of education. And we've been a number of years now, starting very small, but we've had an amazing experience with our PAs working in the health system. I'm very lucky. I was the first person to have a PA. But in times of need, when we came to the COVID crisis, the PAs have been transformative because they are multi-purpose, multifunctional, incredibly helpful, talented healthcare professionals who have had such an important role in many aspects of the COVID crisis. They have been integral and are now a part of the teams in Beaumont Hospital in neurosurgery, in vascular, in breast, and in colorectal, and in ENT. None of us could survive without them. The infectious disease team now, with the COVID crisis, they're integral to it. Rolling out the vaccination program here in the hospital likewise. And they have moved and spread to other hospitals throughout the country. They have also been introduced into primary care. And I think we're going to see over the next number of years incredible progression in their development throughout Irish healthcare. So we've started small. We're very lucky to have them. I feel privileged to have one myself. I'm looking for another. There are more graduating now at the end of January, but I can tell you they're all booked up and there's a queue for people looking for them. But I think they're an integral part of the future of healthcare. So I've had a wonderful experience with them. They're truly amazing to have around you. They transform your clinical practice. We've evidence that they make clinicians 30% more effective, and we've strong data on that. So I'm delighted you're all here, and I hope that this webinar will help you understand about the PA education and about their potential role and how you can learn more about them. Lisa, back to you.
Thank you so much. And your support and ongoing advocacy for the program and for the profession is truly appreciated. So it's been a pleasure working with you just these last few months. It's been a joy.
Great.
So we're going to move on to our next speaker. And again, who I describe as the backbone of this program, someone who has been with the Physician Associate Program at RCSI from the very beginning. It's my pleasure to welcome Dr. Pauline Joyce, who is the Academic Director at the RCSI PA program. Pauline?
Thanks, Lisa. Delighted to be able to present this afternoon. Next slide, Laura, please. So just briefly, what is a physician associate? A healthcare professional trained at graduate level, qualified to provide medical services to patients within the defined scope of practice of their supervising consultant or GP. So there's just an infographic of a summary of what a PA can do. We call them PAs for short, and they're trained within the School of Medicine under the medical model. Next slide, Laura, please. The history, Prof Hill has briefly alluded to the history going right back to when Professor Kelly had an interest in getting PAs over to Ireland. But I suppose we got off in earnest with a pilot project between RCSI Beaumont Hospital and the Department of Health from July 2015 up until October 2017, where we recruited 4 PAs from North America and located them within the surgical directorate at Beaumont Hospital in the services of breast, colorectal, vascular and orthopedics. During that time, we set up a number of projects. In fact, we set up 11 in total, and we had very positive results from the projects. So over the 2 years plus, we did our own internal evaluation of the pilot project, collected quite a lot of data, as Prof Hill has alluded to there, and we also had independent evaluations ongoing by an evaluator who was recruited by the Department of Health. And all of these evaluations were very positive, and we have a number of publications in that regard. We had our first graduates in 2018. Next slide, Laura, please. Our programme is a postgraduate programme, so our students come in with a primary degree at level 8, so they've already done 4 years in a science-based degree or health sciences degree. And the programme that we have set up is a spiral curriculum where we have a lot of modules going on at the same time. And the modules, the foundation one is based on the same as the School of Medicine, using a systems approach, but is an accelerated programme. So there's quite a demand on these students during the programme. It's full on right throughout the programme. And we are lucky to have our tutors from the School of Medicine also teach into the programme. But right through the programme, you can see we have our clinical application right through from the very first day they come in right into second year. And the whole programme culminates in a dissertation, which is a quality improvement project. Next slide, Lisa, please, or Laura, please. That's just briefly what we have within those modules, very briefly, but just you'll see that anatomy is included up there as well. So our students do the same dissection course as our medical students. So quite a lot for them to do during the 2 years. Next slide, Laura, please. We are delighted to be welcoming our 6th cohort of students next Monday, in fact, on the 18th of January. And you'll see there how small we started off with 6 students in 2015, and they completed their programme. It's over 2 calendar years, I should have said as well. So it's equivalent really to 3 academic years. These students do not get the summer off like the medical students. So we're growing our programmes slowly, as Prof Hill said. We're keen to get all of our graduates in employment, but we find now with a small group coming out at the end of January, all the jobs would definitely be taken up, and lots of offers already there for those students. We have a small immediate faculty in our PA faculty, but we're looking forward to welcoming another member in the next few weeks. But we also are within the School of Medicine, so we draw on all our consultants, our tutors, etc. to teach and examine into the programme. Next slide, Laura, please. We have clinical rotations right across the spectrum in medical and surgical areas, GPs, specialties such as obs and gynae, paediatrics, mental health. We have a minimum of hours that we have in our curriculum for the students, but we average around 2,000 hours for the programme. Like the medical students, we've mirrored what our medical students do because they work within the medical team with case presentations, OSCE simulations and exams, long case simulations, and we also have a clinical skills passport that the students must undertake certain clinical skills before they qualify. Our assessments are diverse, so you can see a list of those there, including presentations, because we're getting the PAs ready to present themselves as a core member of the medical team. Next slide, please. Our employment, as Prof Hale alluded to there, is right across. You can see in this slide that it's not just within the RCSI hospital group, but we've had a lot of interest outside of the hospital groups. I'm delighted to see some people from other hospital groups on the webinar this afternoon, and I've been in touch with a lot of those people already. But you will see that right across specialties, I suppose we've started off with a lot of our graduates in surgery, and that's really going back to the support of our surgeons initially for this programme. But we're delighted that we're getting our graduates into medicine as well, where they're suited. So right across the public sector, the private sector, and in primary care. And I've just said there that some organisations, and some of them are on the call here, have sponsored our students. And this is one really innovative way that we support students coming onto the programme, because these graduates do not have time to work during the programme. It's full on for the 2 calendar years. They support themselves. There's a lack of funding for them, so we're delighted with some organisations have provided scholarship, and that scholarship is ongoing, and we're reaching out to other organisations. So if you want to get involved in that, that's another way to support students, and then you have a better guarantee of getting a graduate at the end of the programme. You'll hear more about the Irish Society of Physician Associates, but all of our jobs are advertised through the Irish Society of Physician Associates, and this is a patient safety issue really, because they're registered with the society, as you'll hear from Maria, and that's where we feed the jobs. Next slide, please, Laura. I'm back to you, Lisa, now. Thank you.
Thank you very much, Pauline. Very succinct but comprehensive review of the program. Now, many of you probably are wondering, what is the regulatory framework that gives PAs the privilege to practice, excuse me, as PAs within the Irish healthcare system? And what I can tell you right now is that we are working collaboratively with the Department of Health, and we have been since the beginning. As Pauline mentioned, this was a funded program, and this was thought to be the beginning of the framework for the regulation of this profession. However, things take time, and now especially you can understand that the Department of Health's focus and responsibility is to the public health of the country during this pandemic. So it's probably not an ideal time to be pushing for regulation, but professional recognition would be a start, and that is one of the goals that we have set for the near future. And I think it's very consistent with the transformation of the Irish healthcare system that is part of the framework for the Department of Health. So as a non-Irish trained PA, I can tell you that it does take time. During my first years out of training in the United States, I worked in the District of Columbia, and we had no regulation. Essentially, I had to pass my national board exam, and I could then gain employment. And it wasn't until a number of years later that they had the regulation and the policies put forward through the Medical Council. So that's just one example, but we'll talk about that a little later on in the webinar. I'd like to introduce our next speaker, and that is, she is Maria Macken. She is one of our graduates from the RCSI PA program. I like to call her one of our homegrown PAs in the Republic of Ireland, and she's going to talk a little bit about the Irish Society of Physician Associates. Maria, welcome.
Thanks, Lisa. Next slide, please. So I'm just going to talk briefly just about the society and kind of how it started. So in May 2019, the Board of Directors was elected by the Physician Associate graduates. So these were the Irish PA graduates from RCSI. So the board is currently represented by PAs who work in in public and private hospitals, as well as primary care. And we work in both medical and surgical specialties. And then in May of this year, then the members of the ISPA will vote to elect 5 new board members. Next slide, please. So what is the purpose of the ISPA? To support the development of the PA profession, to keep a record of all physician associates working within the Irish healthcare system via a managed voluntary register, to hold the Irish PA national exam annually, which I'll talk to in a few moments, to hold conferences and revision courses in preparation for the Irish PA national exam, to offer support to hospitals and primary care facilities surrounding the role of the PA. This includes scope of practice, roles and responsibilities that are undertaken by the PA. And also, as Pauline mentioned, we communicate the new PA posts to the ISPA members. Next slide, please. So the Managed Voluntary Register is a list of all of the PAs who are currently working in the Irish healthcare system. And in order for a PA to be listed on the MVR and receive an MVR number, they must fulfill the following criteria. So they must be a graduate from an accredited PA program, either here or in, for example, the UK or the US. They must successfully pass the national exam in the country where they received their degree, but also they must successfully pass the Irish PA national exam. And then thereafter, they must recertify every 6 years. They also must earn 50 CPD points every year, and they must maintain their membership with the ISPA. And as Pauline mentioned, this is a patient safety thing, and it's really important to us that PAs are members of the ISPA. Next slide, please. So the Irish Physician Associate National Exam, as I mentioned, upon qualification of an accredited PA program, all PAs must pass the Irish PA National Exam in order to become an Irish certified PA.
What are you doing here?
They also must recertify every 6 years in order to demonstrate competency in all medical and surgical specialties. And with regards to whether a PA can work before sitting or passing the national exam, at the moment is at the discretion of the individual employer or consultant. But we encourage all PAs to sit the national exam. Next slide, please. So in terms of continued professional development, all PAs must earn 50 CPD points annually, and this is a mix of major and minor criteria. So, for example, as you can see, major criteria attending conferences or workshops or undertaking additional study, and minor criteria would be presenting at journal clubs, MDT meetings, and grand rounds. And this is something that PAs are doing every day. Most of the time now it's on Zoom, but we are, it's sort of easy enough to rack up the CPD points between all the different meetings that we're involved in. That's pretty much the ISPA in a nutshell. Back to you, Lisa.
Thank you. Thank you very much, Maria. I think it's also informative to our attendees to know that when the Irish national exam was developed, there were consultants brought in from the United States and also the United Kingdom who had experience developing such exams. And I believe that they were instrumental in helping the small collective of Irish PAs and come up with an exam that's of the highest quality and additionally does, I believe, do a good job of identifying those individuals who are not suited to perform the duties that are associated with practice as a physician associate. So I think that the public can have confidence that that exam, in addition to the very demanding and highly accelerated training program at RCSI, that these individuals are highly qualified when they graduate and very well prepared to take that very difficult and rigorous exam. So we're going to move forward to a panel discussion now on best practices for hiring, identifying, and credentialing physician associates in Ireland. We will absolutely take questions after we finish with the panel discussion. So if you'd like to ask a question, I would urge you to use the chat function in the webinar platform. That will help us to perhaps cluster and categorize similar questions. So I'd like to introduce our panel participants. We have Roseanne Killeen with us, and I did not acknowledge her earlier. Roseanne, are you here?
Here, yes. Hi.
Would you mind telling folks who you are and what you do?
I am a group HR manager in Ireland East Hospital Group, and I've been involved in recruiting and bringing PAs into Our Lady's Hospital Navan, and now hopefully more into Ireland East Hospital Group as well.
Terrific. Thank you for participating, Roseanne. And we have myself, Dr. Pauline Joyce, and two invited guests that I'd like to introduce. First is Kate Stratton. She is a PA from the United Kingdom and holds the title as President of the Faculty of PAs with the Royal College of Physicians, and is a faculty member at the University of Birmingham's PA program. And our other invited guest is Karen Roberts, who also was instrumental in the development of PAs in the United Kingdom, and she is currently a lead course director, I believe is the title, and reader at the Brighton and Sussex Medical School. So welcome to you both. So I'm going to start with Pauline, and I'm going to ask how, if I were someone in the health system in Ireland and looking to hire a PA, how would I go about that? How do I find these people?
Okay, so Maria has given on her slides the website details of the Irish Society of PAs, which is where we're now feeding in the jobs into, and there's also an email there. But we're happy to take any queries as faculty of the PA program, and then I can send them to the ISPA, so that isn't a problem. And you know, sometimes we get these queries through our own students, through our graduates, and we're happy to filter them, but really they should end up with the ISPA. And again, myself and Maria have emphasized, because you can check that these, you know, the people who apply through the ISPA communication will have gone through an accredited program, will be registered on the Managed Voluntary Register, and will have set the exam, or will be, you know, registered to sit the next exam.
So, Pauline, in the United States, I often found that many physicians would contact the program and say, I'm thinking about hiring a PA. Could I have a student come for an elective or one of their placements? Is that another strategy where someone would sort of field test or have a trial with a PA?
Yeah, absolutely. And thanks for reminding me, Lisa, because we have been doing that through the RCSI program. And I think it's probably the best way to give the organisation an introduction to the PA role, because as we know from your huge experience and others, that the best fit has to be the personality fit as well as the skills and the qualifications of the PA. So I always encourage people, and in fact we have some of our final year students with some of you on the call down the country at the moment doing their elective, who have advertised already for a PA, and I said, do you want to take a final year student for an elective or whatever it is, and then see how the role fits. You know, that's an introduction of the role to the organisation, etc. So that's an excellent way, Lisa, and we've been using that, as you know.
Great. Okay, thank you. Our next question is, who determines the PA scope of practice? And I'm going to ask Maria if you would be willing to take on this question.
Yeah, sure. Thanks, Lisa. So there is a framework or a template for newly qualified PAs, and this can be distributed to employers or to consultants. But as the PA role evolves and there's a lot of on-the-job training, the scope of practice, you know, changes can change quite significantly, depending on what the PA is doing. For example, opening or closing in theatre. So the scope will change, and this is determined over time with the consultant and the PA.
So the sense of delegation by the consultant is really sort of a model that's in practice here in Ireland as it is in the US, I would imagine, right, Maria?
Absolutely. And often the duties or responsibilities undertaken by the PA are determined by the needs of the service. So not all PAs are going to be assisting in theatre. They may be required to be seeing patients in the clinic. And this can change throughout, you know, initially when PA started off can change throughout as the needs of the service change, but also as the experience of the PA and the responsibility of the PA, it will change too.
Okay, great. Thanks, Maria. Pauline, could you maybe differentiate for us are the PAs the same as the advanced nurse practitioners? I know this is a question that comes up quite a bit. And if you were hiring for a nurse practitioner, would you necessarily look at a PA for the same job?
So they're both different roles, but there's lots of synergies between both. And in fact, when you read up any of the literature on PAs and NPs, as they're called in the US, they're seen as advanced practice providers. So there are synergies, but there's also differences. And it's not that employing one over the other is better. You may actually, in fact, have both on your team. So as we know, the PAs are trained in the generalist model, and it's the medical model. Advanced nurse practitioners, as we call them here in Ireland, are more trained to go down the specialist route, and both have to have a master's degree qualification. But for the ANPs in Ireland, they've been quite specialist. I know that some of the rules around ANPs are recently changing as well. They used to have to be 5 years in that particular specialty area, etc. But that's changing a little bit. Mm-hmm. So quite specialist there. The PA, as we said, will always have a dedicated supervising consultant or GP. The ANPs can work maybe more autonomously sometimes as well. Currently, and this again is changing, is that if an ANP works in, say, cardiology, they can only prescribe for that area, whereas again the PAs will be more generalist. So lots of synergies. It's not that one is better than the other. They, both contribute equally to a team, but one is the nursing model, obviously, and one is a medical model.
All right, good. Okay, thanks, Pauline. The next question is, who provides indemnification? And I wonder if Roseanne could comment on this.
Yeah, no problem, Lisa. So typically the PA would, or in most cases in a public hospital, the PA would have a contract of employment with that hospital, which in turn gives them indemnification with the HSE. That might be a little bit different in private hospitals, but typically any employment contract will provide indemnification. In general practice, the PAs can be added to the practice plan, or they can carry their own personal policy.
Okay, thanks. I think the next one might be, this is something I've heard from people just having been here the short time that I have, and it would be, what is the PA career progression? And for this, maybe I could ask Karen Roberts from the UK to talk a little bit about what they've seen in the United Kingdom broadly, most specifically probably in England itself. But go ahead, Karen.
Thanks, Lisa. So if I just touch to begin about the career itself and where most people were, and in the early days, we actually also brought in qualified US experienced PAs. And then the UK PAs started joining, and it was mainly emergency medicine and general practice. But over the past, the first qualified PAs took the national exam in 2007. So we're, over 13 years of experience now, almost 14. And now we're in almost every single specialty, and that's medical specialties, general practice, and also surgical specialties. And so it's really interesting and actually encouraging to see that broad spread across the breadth of medicine, where we can really have a huge impact. For individual PAs, the vast majority have started, and we have this agenda for change banding here in the UK, and most PAs have started on band 6 or 7, many on 7. And over time, actually, PAs are now moving into band 8, band 8A, or even higher, and they're taking on managerial roles, or they'll take on a key role within a trust. So we have someone who's been a recess officer for the trust, or we have PAs who are partners in their GP practices. And I think really the sky's the limit for us on our professional development and our progression. So if you want to split your time between clinical practice and education, or be a researcher, because sometimes we have applicants who already have a PhD. They've been researchers, and actually now they want to do something clinical, and they can combine those two professions so well and have such a impact on patients and on the service in general.
Great, that's wonderful. And I wonder if Roseanne could maybe speak to credentials that an HR or a hiring manager might be interested in validating upon the hiring.
Yeah, no problem. So just the same as with any employee, I suppose, coming into the health services, they would either be asked for a CV or an application form, and then documentation to support that would be if they needed permits, if they were coming from outside of Ireland, those permits, and then qualification, documentation or status. They would also require Garda vetting if they're coming into the health services. They'd have to have an occupational health review and be passed by occupational health, and then 3 valid references.
Okay, great. And Karen, is this the same in the UK, or Kate? Who wants to take this one? Karen?
Yeah, I'm happy to take it. It is the same, except we don't, our job adverts go on NHS Jobs or through other job agencies. And so there is no control. We strongly encourage employers to check to make sure applicants are on the managed voluntary register in the UK, but they don't have to. However, this will absolutely change when we become regulated by the GMC in the next year. And so then obviously they will have to have a license to practice. And so that's very encouraging. So it's very similar. Some employers I notice are asking applicants if they have experience doing a quality improvement project or service improvement project. Not all of the 35 plus PA programs in the UK offer that, but some do. And I think that's a really good experience for students.
Great. And finally, Maria, could you address whether or not there's a difference between a PA working in GP practice and a PA that's working in a hospital?
So I suppose as Pauline said, we're all trained to the medical model. So we're trained as generalists, and a PA can work in a GP practice, and after any length of time decide maybe hospital medicine is where they're more suited to. So we are trained the same and deliver the same skill set, but the things that we're dealing with day to day will absolutely vary. I know from my own practice, I'm working on the spinal service and the matter. So a lot of the patients that we see are trauma patients that have sustained spinal cord injuries, versus when my colleague Laura is a PA working in a GP practice. So patients are generally walking into her, although sick and needing medical attention, their primary complaint will absolutely differ. Yeah.
Right. Well, thanks. That's very helpful. And I do think that there are, one of the hallmarks of the PA training is that as a generalist, you find that these PAs are terrifically adaptive and flexible. Some have used the word nimble and being able to pivot. And we saw this even during the COVID outbreak in March, where the PAs at Beaumont really took a leading role in helping to set up the pods and do some research around training people to swab and things like that. So that's just one example. I would like to actually invite Kate Strachan, who, as I said earlier, is the president of the Faculty of PAs at the British Royal College of Physicians. And maybe, Kate, if you could just summarize the progress that the UK has made towards regulation, I think that would be informative for our attendees.
Sure, no problem. So as Karen says, we've had PAs in the UK over from the US since 2002. We've been lobbying for regulation for quite some time, but unfortunately, due to a variety of changes in governmental decisions, shall we say, we were told in 2010 that there would be no new statutory regulated professions. And we've basically been fighting that since then, trying to get the point across that actually looking at the scope of practice of a PA, it is vital that we are statutory regulated from a patient safety perspective. So there was a public consultation in 2017, and we heard in 2018 that PAs would be regulated alongside anaesthesia associates under an umbrella of professionals called medical associate professionals, or MAPs. And so the GMC were taking on 2 of the 4 professionals within the MAPS group. We were told in 2019 it would be the General Medical Council. There was apparently some conversation for a long time as to who would be the best regulator. And it was again decided that because the PAs aligned to the medical model, because PAs are part of the medical team, GMC would be best suited to be able to do that. And so the GMC are currently changing the way that they work to be able to work with more than one profession. So I've been working quite closely. I've been president of the FPA for 18 months now, and I've been working quite closely with the GMC and other bodies. It was announced a week before I started the role, so, you know, in at the deep end. And we're still set for end of 2021, fingers crossed, touching wood, everything else, that's when registration will start. So from our perspective, actually, it's great news. We'll see what COVID and what Brexit and everything else has all done in terms of delays. But at the moment, the Department of Health is confident that we should still be able to work towards the end of 2021. It just means that things have been done in slightly different orders. So it's been quite a long road, but we're almost there. Just in terms of what we said earlier about the Managed Voluntary Register, at the moment we have about 2,100 PAs on the register. So we're at about 90% or so of the profession have chosen to sign up. And I think in part that's because employers understand the importance and value of the register. But also PAs want to be part of that community. PAs, want to be able to work together and represent in a wider picture as well. So that's where we are at the moment. That opens the doors to things like prescribing, being able to request ionizing radiation and so on in the future, as well as the sort of more formalised career pathway that we're working on.
Well, kudos to you and to Karen for your steadfast leadership across many, many years in the UK. And we're just so proud of all that you've accomplished. Listen, how many graduates a year do you see in the UK?
It's about 750, 800. There are 36 courses training in the UK, and we have a national exam, which currently sits 3 times a year.
Wow.
And so across we've had slight variations in numbers, partly because of COVID, etc., and delays that have been put on that. But in the last sitting, in September, October this year, we had, I think there were just over 500 candidates took that exam. Now we have a theory exam. We also have an OSCE exam at national level. Right. Which I know is something that we discussed with ISPA for sort of longer term when there's more than one provider and so on. But we do have both for us. So that was 17 days of OSCE exams. So I can't believe, I was so relieved when we got through those, and the RCP education team did a great job pulling that off.
That's wonderful, especially given a global pandemic.
Right.
So we will now, let's see, we have a few minutes that we could entertain questions if there are any. I know Pauline has been monitoring the chat, but we hope that we've addressed them.
Lisa, if I could just come in, there are a few. I've responded to a few by text, but there's a few that probably warrants maybe some conversation for others as well. So if you want me to pick up on a few.
Yes, please. Mm-hmm.
Yeah. So there was one there about the pay scale of the PA, and there isn't a pay scale benchmarked as yet by the Department of Health. So that exercise still has to be done, as well as, formally recognising this role by the Department of Health so that it is on the HSE pay scale. So that exercise hasn't been done. But I suppose all we've been doing in the meantime is guiding people as to, what the PAs, the first employed PAs were at Beaumont and what was the salary scale and what did we use for the pilot project. So for the pilot project, because to recruit PAs from North America into that position, there were non-training NCHD posts vacated to take 4 PAs. So we use the SHO pay scale between 40 to 45,000 as a benchmark for the pilot. And also that seemed to match with the agenda for change in the UK at band 6 or 7 at the time. So that's what we've used. But, you know, if you're interested, we can let you know what's happening that we know of in other places. Right. That's the pay scale as regards the benchmarking of that. There are a few questions, Lisa, about indemnification, further ones, and I know that Rachel is on from MPS and there's also a Medisec representative on. And I suppose just to follow on from what Roseanne said about indemnification for GPs, all we can tell you is just our experience from the graduates we have in primary care settings at the moment. And we know that an insurer called First Ireland has indemnified some of our PAs in that setting. We have been in touch with MPS, I know in the past, and I see MPS are happy to support us in moving things along with regulation. And the question came up, I think, from Rachel, where are we with regulation? And we're following up with the Department of Health. It is their call to the regulatory unit in the Department of Health to move this on for us. So we've been, since the pilot project, continuously liaising with the Department of Health about this. So that's where we're at with that, Rachel, at the moment. So that's that question. And then Maria answered the one about study leave and annual leave, and there was another one there about sponsorship. So there's some responses into that. Another one came from one of our colleagues at Beaumont about the entry criteria. We have said, and I've said probably in my slides, that we take on graduates who are at level 8 with a science or health sciences degree background. And the query is from David, is that while he acknowledges it's a tough program, it's 2 calendar years, an accelerated program, do we take on anyone without the science or health sciences background? The answer to that really, David, is that it's such a tough program that we want our students to succeed. It's a new program, and for now we're just taking the students with the background in science and health science. And I think, Lisa, from your experience in the US and from our colleagues in the UK, I think that is something that happens there as well. I know in the US you have courses you can take, so you might want to address that as well.
Yes, I can tell you that in the early days of the profession, which many of you probably know the history, but there were many Vietnam veterans who were serving as medics during the war, came home and had no traditional undergraduate college experience. And yet they had significant skills developed on the battlefield. And this was the early days of the profession where Dr. Eugene Stead at Duke University felt that there needed to be a role for these highly trained veterans coming back. And perhaps they could be trained up, if you will. And so the early days, these were not traditional students. They didn't have the science background, but they did have significant clinical experience. I would say now it's unusual to have someone who, well, in the United States, it's a postgraduate degree like it is in Ireland. So you have to have an undergraduate degree. But we definitely have relaxed our standards in the sense that it isn't imperative that you have 2,000 hours of clinical experience. Some programs still hold on to that as a benchmark for clinical experience, but other programs have reduced it significantly because the research really hasn't demonstrated that the clinical experience really has an impact on the student's success. If you use as a benchmark the outcome of, say, passing the national exam. I do anecdotally know that I've had many talented students come to us. One student in particular, I remember, he was a French major as an undergraduate. He then decided he wanted to become involved in medicine, did not want to go to medical school, chose to become an EMT, and then took his prerequisite courses, which took him about 2 years of heavy science courses in combination with working as a paramedic. And he was one of our top students that completed the program. But I do think in the early days of a profession, as we have in Ireland, while we know there are many, many people who would love to gain admission to the program, we have a high mark, if you will. And sometimes when a new profession emerges in a culture and institution such as medicine, it's very hard sometimes to convince people or persuade them that this new cadre of health professionals is talented and can undergo the scrutiny, if you will, of some people who may not be convinced that they should be in the profession or that the profession should even be regulated. So I think at this time, we don't have plans of relaxing our admission standards, but I do think that we could start to think, because I do believe that the interest in this profession is going to continue. And I see significant growth opportunities, especially since yesterday when in the United States, the U.S. News and World Report came out and said that the physician associate job in the U.S. was ranked #1 for all healthcare workers. So it certainly has created quite a buzz in social media, and I suspect that we'll continue to see growth here in Ireland. So Pauline, do you see any other questions we'd like to address?
No, there's some of them have gone back individually too, and I suppose I pick up on it and might be of interest, and Roseanne has gone back as well and supported us on it. The query was, do you have to give up an NCHT post to take on a PA? And I've said no. That was the only way to get the pilot underway at Beaumont Hospital, but the more recent recruitment of PAs at Beaumont Hospital are additional posts. And Roseanne has clarified as well in her setting that they've used NCHT posts that they could not fill in that particular setting. So it varies.
I think that's an important point and a question that I think has been on a lot of people's minds.
Yeah.
Okay, Laura, could we go to the next slide? I don't see any more questions. Do you, Pauline?
No, I think we've addressed them, hopefully.
So the purpose of this webinar really was to not only introduce the concept of the PA, but in response to many, many potential employers contacting the program and asking us, how do I hire a PA? How do I go about finding PAs? What are they trained for? And I think that this webinar was essentially in response to those inquiries. I'm sure after listening to us today, there may be many more questions that you have. So we welcome you to reach out to any of us, myself, Pauline, Maria, or Roseanne, as we can help navigate perhaps many of the sort of twists and turns you might experience with hiring a PA, or if you know a student who would be a great candidate, please refer them to us. And I guess that's about it. We want you all to stay safe and remember public health guidelines. We're certainly thrilled that you all came out today, and this will this has been recorded, so we'll have it up for others to view should you want to refer anyone else to the webinar. So on behalf of everyone at RCSI and the PA program, thank you so much. Good afternoon.